What is Medicare Secondary Payer, MSP, and how does it work? Imagine you get a bill for medical care, and you're not sure who should pay first. That's where Medicare Secondary Payer comes into play. It's a rule that helps decide who pays first when you have more than one insurance. Medicare Secondary Payer is part of the Medicare program that kicks in when Medicare is not the main insurance responsible for paying your medical bills. Instead, another insurer or entity must pay first. Medicare only pays after the primary insurer has paid what it owes or if it doesn't cover the full cost. This process helps protect the Medicare Trust Fund by making sure Medicare pays only when it's supposed to. You might find Medicare becomes the secondary payer in several common situations. For example, if you are over 65 and still working with a current employer or your spouse's employer that has 20 or more employees, that employer's group health plan pays first. Medicare then covers what's left. If you have End Stage Renal Disease, which is a type of kidney failure, Medicare is secondary during a 30-month period if you have group health plan coverage through current or former employment. During this time, your employer's insurance pays first. In cases where you have no-fault insurance, like auto insurance that pays regardless of who is at fault, or workers' compensation, Medicare pays second after these plans. The same goes for liability insurance or any third-party coverage responsible for your medical expenses before Medicare steps in. Here's how it works day to day. First, the primary payer, such as your employer's health plan or auto insurance, processes and pays your claim first. If they don't cover the full amount, Medicare can pay the remaining eligible costs. Providers must send claims to the primary payer first, then to Medicare, including details about other insurance coverage. Medicare uses information from different sources like the Benefits Coordination and Recovery Center, your provider, your employer, and your answers to questions to figure out if Medicare is primary or secondary for each claim. Employers with group health plans that cover Medicare beneficiaries also have to report coverage details to Medicare's contractor and meet deadlines to avoid penalties. In special situations like dual eligibility, where you qualify for both Medicare and Medicaid, MSP rules make sure Medicare pays correctly in relation to other benefits. This helps prevent paying twice for the same service and clarifies which program is responsible for specific care. Overall, MSP makes sure that when you have more than one insurance, Medicare pays its fair share only after the primary insurer has paid. It keeps the system fair and helps protect Medicare funds. Whether it's employer coverage, auto insurance, or other programs, the rules are there to make sure claims are handled properly and everyone gets the right coverage at the right time.